Well, while the autumn respiratory virus season hasn't started yet, there's a growing summer wave of COVID-19, if you can believe it.
I can, honestly. Joining us to discuss this new, well, not new, but it's coming back around, is 9 News medical expert Dr. Paul Coley. We've been talking a lot about the foodborne illnesses. It's kind of like taken over the headlines, but I personally know like 10 people, including family members, who've had COVID this summer. You thought it was gone, and it's like, surprise, we're back. What's going on with COVID?
It's not gone, ladies. Yeah. It's now endemic. So we're going to see it every single year. What's different about this virus is we see this kind of biannual peak. So usually respiratory viruses we see peak in the winter. COVID for the last 2 years has peaked in the summer, the mid to late summer, and then we have a second peak in the winter. So this is not unexpected. It's going up in 47 states, ours included, with the highest levels in Alex's state of Texas.
Oh, makes sense.
The wastewater there is kind of sky high. So overall numbers are low compared to what we see in winter, but high enough that it's certainly getting our attention.
Okay, well, I'm glad we're talking about it. In fact, the FDA just approved a new preventative medication. Is that true? Preventative?
Yes, so this is a big deal. This is a medicine called post-exposure prophylaxis. It's called Xocova, first and only prevention medicine for COVID. Okay, and the idea here was that we really had sort of a gap because you get vaccinated and then you could still be exposed, and then you just have to sort of wait it out and see whether or not you get sick. So this is for people who have been exposed, usually to a close household contact, but not yet tested positive. And the idea is to take it within 72 hours of exposure. So as soon as you sit next to someone on the plane, or your significant other has it, or your best friend has it, you take this pill. You take 3 pills on the first day to get the levels up in your bloodstream, and then 1 every day after for a total of 5 days. And what it does is if the virus got inside, it prevents the virus from replicating, from essentially taking hold inside your body.
Nice. And it just kind of came up because we've been dealing with COVID for 5 years. I'm glad they came up with this. Why is it happening now? I
think it's happening a little too late, Alex. It's been in Japan for several years.
Really?
Are you serious?
And they use it for treatment over there. But our FDA just kind of took its own sweet time to get it approved for prevention. Now, it's not approved for treatment here in the U.S. So if you do end up getting COVID, then you have to switch to Paxlovid. But the efficacy is really remarkable. So they took people who are exposed to household contacts and randomized them and said, you get a sugar pill and you get Xocova. And we see how many people end up turning positive. So it reduced your risk of getting COVID after being exposed by 67%.
And let's say you do get it. Does it reduce like the severity of it? And also when you do take it, do you get sick? You know how sometimes that can happen?
Yep. So if you do get it, you usually should stop it because it's not approved for treatment, and then switch to the treatment, which is Paxlovid. Now, having said that, they are using it in Japan for treatment. So you can talk to your doctor and see if you can continue on it. But usually it means you failed this particular antiviral and you need the Paxlovid instead. Pretty well tolerated. But in the clinical trials, they did see headache, cough, and diarrhea were sort of the most common side effects. But you can imagine we have this whole host of super vulnerable people, right? We know that our vaccine's not perfect. The good news is the current variant is not all that aggressive compared to what we've seen in the past. But let's say you live in a nursing home and someone else has it, or let's say you're immunocompromised, or even you don't want to get sick. I think this is a really reasonable option for you to talk to your doctor about. Now, it does interact with statin medicines. You can't take it if you're pregnant or breastfeeding, and it can interact with other medications as well. So I don't want you to just go and get it from a doc in a box somewhere and start it. I want you to talk to your primary care doctor and see if it makes sense. But the sooner you call, the more likely it is to work better.
Nice. Good info to have. Dr. Coley, thank you.